Good afternoon, everyone. Thank you again for joining us for the EPCS Controlled Substance Prescription Monitoring Program, CS PMP webinar. This presentation is provided through a shared commitment between Health Current, Arizona Health Cost Containment System, ACCESS, the Arizona Department of Health Services, ADHS, and the Arizona Board of Pharmacy to manage and coordinate the statewide EPCS Click for Control education campaign. Just a few logistic reminders. Today's webinar will be recorded and posted to the Health Current website. Please use the chat box for questions or comments. Please include your name, practice organization, and as always, please do not include any confidential information such as patient health information or PHI. All lines are muted. Lynn, I have passed the ball to you, and Lynn Curtis will be giving our presentation today. Lynn is the CS PMP Marketing Specialist for the Arizona State Board of Pharmacy and will be presenting today's webinar. Lynn, are you with us?
I'm here. Thank you.
Wonderful. I'm going to turn it over to you.
Excellent. Thank you so much, Christine, for all the technical help in the introduction. I greatly appreciate it. I also appreciate Health Current allowing me to be a part of this and inviting me out. I'm very excited to spend the next 45 or so minutes with everybody that's online to talk a little bit about the CSPMP and some of the statutes around that. From here on out, though, you will hear me refer to it lovingly as the PMP, and that's what it is a bit of a mouthful, so it will be the PMP. When I say that, it's the same as the CSPMP. So let's just really briefly talk about what we're going to talk about today. I'll give you some information on the PMP, some updates on the statutes around the PMP, some of the requirements that are out there that you might or might not be familiar with. We'll talk about some of the reports that are available and how to use it, gain easier access when you're using it. Typically, the next section would be about the electronic prescribing of controlled substances. I do a brief high-level overview of that, but since that mandatory use has been suspended right now, what I'm going to talk about today instead of that is going to be through the Board of Pharmacy's perspective, some of the COVID-19 updates that have been put in place for pharmacies that could affect you and your dealings with the pharmacies. So we'll talk about that a little bit. And then I always end with some additional tools and resources that are out there for those who are involved with helping folks with prescribing and dispensing of controlled substances. So with that, let's go ahead and get started. So let's talk about what the PMP is. Of course, it's a database. It's a database that medical providers can access when they are assisting a patient or helping a patient, and they want to find a record of their controlled substance prescriptions that they've had. The way that the data is inputted into the database is mostly through the pharmacies. So that's the reason why I work at the Board of Pharmacy. So it really is a record of all controlled substances that have been dispensed. There are other situations we'll talk about a little bit later where others would have to report into the PMP itself. The main report is the report that you're seeing right here. It's the patient utilization report. This is an old example of one, so it looks just a tad different nowadays, but I just want to kind of go through really quick and share some of the things that are in the report. Before I do that, I want to give you just a little bit of a background, maybe some fun facts and figures you might or might not know about the PMP. The Arizona State PMP started in 2008, so it's been around for a while. Every state in the United States has some form of a prescription monitoring program. Some of them are a little bit more encompassing than others. And the one sort of oddball out there is the state of Missouri. They actually do not have a state-run PMP, but St. Louis County in the state does have a PMP. So that's a little bit of an anomaly there. Currently, We are connected to 36 states. Arizona is connected to 36 states, and one of those states is the military health system. They're considered their own state, so to speak. And you're probably asking yourself, why are we not connected to all 50 states? Well, it comes right down to statutes. We have statutes that mandate what we can share and not share. And so it's a little bit like dating in the sense of we get together with another state, we share with them what we can share, and they say what they can share. And if it doesn't work out, then we don't make that connection. But we are constantly reaching out, especially as we're getting to the end of the legislative season and new laws are taking effect. We're constantly making that. So hopefully one day we will be connected to all 50 states. We are connected to all of our border states except for California. And that's usually when I'm in a live audience, in front of a live audience, that elicits a little bit of a groan. And again, it's California statutes. That's the reason why we're not connected. But all the other states that we have a border with, we are connected with. Just to kind of give you an idea of how much the PMP is used. This is a statistic from 2018. I need to get this updated, but in 2018, there was 8.9 million queries to the Arizona PMP. So it's a huge database. It's used a lot, but we want to improve that use, and that's the reason why I'm out and about as a marketing specialist doing what I do. So going back to the PMPs, kind of some of the fun facts. Ultimately, it really is providing information to prescribers and to dispensers to help give them the best information they have to treat the patient. It also helps with identifying and deterring misuse of controlled substances, diversion, and for you prescribers out there, it also helps protect your personal EEA number. And we'll get into that a little bit more a little bit later on. So let's go ahead and get into the patient utilization report. Again, this is the main report that's pulled out of the PMP. It's not the only report, but this is the one when you are treating a patient, this is the one that you would pull. The first section is the information about the patient itself, and you'll see that there are linked records in the first section. The reason this is again, this information is inputted by pharmacists, and you might have a Leonard that goes by Len, Lenny, or Leonard. And so anytime they use a different name, but they have say the same date of birth and the same address, that will go in as a different linked record. We also know that we do move, and so we might have the same name, but we might be using a different address with the same date of birth. So again, this list will sort of build if you have been prescribed and dispensed controlled substances. The second section is kind of gives you a quick overview of what's in the report itself. It'll show you the total prescriptions, how many prescribers are involved in the report, how many pharmacists are involved in the report. The opioids and buprenorphine sections, they really just give you a they give you a 30-day window of any active prescriptions that your patient might be on. And again, this is only 30 days back, so it might or might not be filled with information itself. This is the heart of the patient utilization report, the prescriptions itself, and just very briefly kind of share some of the data that's found in here. You have the date that it's filled, and that ID column again will go back to the records before. It has the date that it was written, what drug was part of the prescription, quantity, the dates of the prescription, and very important, the prescriber, the prescription number, and the pharmacy that it was dispensed from, and then any refills that might still be available. In an actual report, let's say that there were 3 out of 5 refills that were available, you would see 3/5 in that refills column itself. And then the last two sections of the patient utilization report, you have the prescribers and dispensers. Why this is important is will give you information on if, as a prescriber dispenser, if you had any questions about why a particular drug was prescribed. This gives you an opportunity, information on whom you can contact to maybe get a little clarity around that as well. So in early 2018, Governor Ducey signed the Arizona Opioid Epidemic Act, and through that act, there was a lot of new legislation that came about that impacts the requirements of using the PMP. And what I want to do now is just take the next few minutes and talk about what changed and what those requirements are. So the first thing is registration for the PMP. If you're a prescriber and you have a valid license from a licensing board and you have a valid DEA number, you must be registered with the PMP. Now we get calls from people that fall in two categories that always sort of question this. The first one is I have my practice, but I don't prescribe controlled substances. Do I still need to be registered? And the answer is yes, you do have to be registered. The other situation is we do get prescribers who are retiring and they just want to make sure, they want to keep their license active, their DE number active, but they don't know if they're going to be prescribing anything or not. They still have to be registered. Couple of things that I want to share about registration. It doesn't cost you anything except for a few minutes. Once you register, you're done. It doesn't expire and you'll be good to go. Now, if your DEA number changes or expires, or if your license, for whatever reason, changes, status changes, then you would have to come in and just update your registration. But once you've done it, it's done. It's done. Per statutes, your password to your account has to be changed every 90 days. So if you're not using the PMP all that much, just be prepared. It's very easy to go in and just update your password so you're able to go in when you do need to use it. If you're a pharmacist, if you got a valid license from the Board of Pharmacy and you are employed at a facility that has a valid DEA number, then you must be registered. For the pharmacists that might be moving maybe to a different pharmacy to work, you want to make sure that you go in and update your registration with that information. There's also a situation where pharmacists might be rovers, so they might be working different pharmacies. We just ask you to pick the one that you consider to be your sort of home pharmacy, and then you want to put that information in there. So again, registration, it's required, never expires, doesn't cost you anything, just a few minutes of your time. So who has access to the PMP? Well, we know prescribers do, we know pharmacists do. Also, delegates have access, and we'll talk a little bit more in depth about delegates later on in the presentation. But basically, a delegate is someone in a doctor's office or in a pharmacy, other than the doctor or pharmacist, who can pull patient utilization reports for the doctor or doctors or the pharmacy or pharmacist. Licensing boards have access to the PMP, as do medical examiners. Now, this list, the folks who are on the left of your screen on this list, they have direct access to the PMP, meaning they have their own account, and everybody must have their own account. They have their own account, they log in, and they can search the PMP. For the folks on the right, it's kind of one more little step, two little steps they have to do to be able to have access. Let's say they have indirect access. If you are in law enforcement or criminal justice agency, what you do is you request a report, you fill out the criteria for the report. There's a comment section, and in that comment section, we ask that you give us the case number and just a little blurb saying that it is part of an open investigation. And then you would submit that. The team receives those. They look to make sure you've got a case number, that you've stated it's part of an open investigation, and then they release the results to the law enforcement or criminal justice agencies. The same goes with the Medicaid fraud investigators. Attorneys can request records from the PMP. They do this through a court order only. We don't accept subpoenas, so they have to have all the information that they want, and once we receive the court order, we will process that and send it out. Now, as an individual, a member of the public, you have access to your PMP, your patient utilization report. There's a couple of steps you have to take. There's a form that you fill out on the webpage. Once you fill that out, you print it out, you go have that notarized, and then you ask that you send that in to us, and you can mail it, you can scan it and email it, you can fax it in. But along with that, we also need a copy of a valid government issued ID. And make sure that we can see it, because sometimes when it copies, it's kind of dark. Once we receive those, we pull the report for you, and then we send it out. For the folks that have indirect access, we try to process these as quick as possible, but usually it's 2 or 3 days turnaround, which is actually not too bad. So now let's talk about when to pull a report. When are we required to pull a report? If you're a prescriber, before you prescribe an opioid or benzodiazepine, you are required by statute to pull a report. It must include the preceding 12 months, which is easy because the default patient utilization report is 12 months long. You can request longer, but that's what the default is. You must pull it for each initial course of treatment. If that treatment turns into an ongoing treatment plan, then you're required to pull every 3 months as you are treating that patient. There are some exemptions to having to review the report. If you're taking care of a patient who has a cancer diagnosis, or if you're in an ED, you're not required to pull the report. Hospice, palliative, or end of life care, you're not required to pull the report. If you are in a skilled nursing facility situation, you're not required. And the medication assisted treatment, or MAT programs or facilities, are not required to pull a PMP report. So pharmacist, when are you required to pull a report? Well, before dispensing a Schedule II controlled substance. Now, if you think back to the previous slide, and hopefully you haven't forgotten this, as a prescriber, your requirement's a little bit different than a pharmacist. A pharmacist is required to throw a little farther net out there when they are taking care of the patient. So prescribers, if you ever receive a call from a pharmacist who might have a question about what they've pulled from the PMP report, just remember that they're maybe looking at something that may be a little bit different, and hopefully you've got that relationship where you're working together for the best outcome for the patient. So just kind of keep that in mind. But pharmacists, they do have the past 12 months requirement as well, and for each new course of treatment. Okay, so appropriate uses of the PMP, and this is really it's very, very simple. Really, it comes down to, if you have a medical provider-patient relationship, you can go in and pull that patient's PMP utilization report. If you are in law enforcement or the boards, it has to be part of an open investigation. So just kind of going, that's very, very cut and dry. But there are inappropriate uses as well. say that your daughter is dating a young man and you want to check up on him because you don't think he's right for your princess. If you were to pull that young man's PMP report without having that medical provider-patient relationship, you have broken the law. Let's say that you are hiring an office assistant in your medical practice and you just curious about their PMP history. It cannot be used for employment screening purposes. That is against the law. It is a Class 6 felony, and it would be something that if it did happen, you would have to deal with your licensing board. It wouldn't be the pharmacy board unless you were a pharmacist. But so there's a lot of ways. It's very easy to use it inappropriately. Make sure that we use it appropriately. So there has been, in the last, I would say, year and a half or so, sort of a re-emerging acceptance of the PMP, where it's becoming more commonly used. We talk to the big health facilities. We talk with the associations, the medical associations, and what we hear is a lot of them are making it a best practice or standard of care to pull the PMP in most cases, and that's what we like to hear. There is that bare minimum requirement by statute, but it is something that is free information for you to have. We'll talk about how you can access it even easier in a few minutes, but it is a big advantage when you're dealing with your patient to give them the best prognosis and the best treatment that you can by having the best available information, and the PMP is one part of that you have at your disposal. It also, again, using the PMP, it can identify, deter, and prevent abuse and diversion. Also, and I'd mentioned this before, and I'll mention it, this is where I really plug this. If you've got your own DEA number, there is a report in the PMP, which is called MyRx. What that is, as a prescriber, you can go in and you can see which controlled substance prescriptions were dispensed using your DEA number. We recommend that you do this regularly, maybe about once a month or so, just a way to make sure that your DEA number has not been compromised. If you find something that doesn't appear to be right, there's a couple steps we ask you to do. One not to do is, at the PMP ourselves, we're not able to fix that. But what you would want to do is pull the patient's report, contact the pharmacy, and just double check to make sure that they uploaded it correctly. Most of the time, this is the reason why it is incorrect in the PMP. They're able to fix it. Once it's been fixed, once it goes through the system, then you'll be good to go. It won't be on your record anymore. If everything was done correctly and it hasn't been fixed through the pharmacy, then we ask you to call your local law enforcement. They have teams that take care of this. They know what to do, and that's where you'd want to go after you've checked with the pharmacy itself. So one last little statute update that not a lot of people are familiar with, and probably most prescribers don't fall in this category, but I do want to remind that there are prescribers who dispense controlled substances out of their office. Since 2018, prescribers are no longer able to dispense Schedule II opioids from their office, with medication-assisted treatment being the exemption here. But the bigger issue that we run into is if you are dispensing controlled substances, you have the same reporting requirements that the pharmacies do. the pharmacies are required to upload dispensations every day, and or the next business day if there's nobody there. Even if you do not dispense controlled substances, you're still required to report, and you must report a zero report itself. So if you fall in this category, just kind of keep that in mind. You can call the PMP team if you need to. There is a tool that's out there that you report into the PMP. It's called the Clearinghouse. We'll help you get set up with that. Again, it doesn't cost anything. We'll get you set up with that, and you'll be able to go with your daily reporting. And again, medication-assisted treatment dispensations are not reported to the PMP. So we talked about the PMP. Let's talk a little bit now about some COVID-19 information I want to share with you. And just a couple of caveats before I start this segment. I mentioned I'm not doing EPCS today. The reason being is electronic prescribing of controlled substances. That requirement has been suspended. It doesn't mean that you can't use EPCS. If you have it set up in your office, continue to use it. That's okay. If you're not set up with EPCS right now, you do have other options that we'll talk about here in just a little bit. So that's one caveat. The other caveat, the information I'm going to give you comes from the Board of Pharmacy. So even though it is relevant to pharmacists and pharmacies, I've picked out the changes that have since the state of emergency that have been put into place that might impact everybody on the call. So I just want you to know that. If you have questions about COVID-19 and you're not a pharmacist, you'll definitely want to check regularly with your licensing board or your association websites to see any updates. I know at the Board of Pharmacy, the changes have sort of, they were coming fast and furious there initially. It's since slowed down a little bit. On the right of your screen, I have given you an example of what you'll find on the Board of Pharmacy website with COVID-19 information, some of the resources you might have, and some of the more detailed situations that have been affected by COVID-19. We do keep our FAQs updated very regularly. Every couple of days, or as new things come to light, we are checking and updating those. So good resource to have. So we know that there was a public health state of emergency declared on March 11th, 2020. And even though last week Governor Ducey was on television talking about some of the changes to the public access, that doesn't mean that the state of emergency has been lifted. We are still in that, and anything that I talk about today will be active until this state of emergency is stopped. The executive order to expand access to pharmacies actually went into effect on April 2nd, and let's talk about some of the things that that addressed. So if a pharmacy needs to close, we have asked that they just don't lock their doors and go home. There are requirements they have to do. They have to notify us, and I believe it's 72 hours before they do it. They also are required to communicate with patients and prescribers a couple of things. How they're going to transfer, or how patients and prescribers can transfer or fill at other pharmacies. So they have to make sure that option is available. Also, they need to include an expected reopen date as well. I don't believe that there have been any pharmacies that have closed, but the second bullet point here is operation hours, change in those. I know a lot of stores that has happened. Pharmacies can do that as well. They do need to let us know at the Board of Pharmacy. As I mentioned before, EPCS is still available, and of course EPCS only is used when we are transmitting Schedule II opioids, but if it is still available, it can still be used. But if you currently are not capable or don't have EPCS capabilities, you may handwrite Schedule II opioids, and it can be transmitted that way as well. In lieu of the safety issues that we have right now, they can also be transmitted via phone, fax, scan, or photo, and this goes beyond the Schedule II opioids to all Schedule II medications. One caveat, the statutes do say that the original prescription must be kept by the prescriber. Again, this is all put into place so we don't have people who need medications are without them. Consultations with pharmacists have changed a little bit, and of course this is with new prescriptions. Pharmacists now can do the consultation via telephone or using the drive-through or other technological means. In some instances in the past, it was required to have a signature to document the consultation. That has been waived during the state of emergency. Also, the Board of Pharmacy is allowing pharmacists and technicians to work remotely. There is a long list of requirements if you do want to do that, and that can be found on the Board of Pharmacy FAQs. Again, going back to the need to make sure that we have patients that they have the ability to have their prescriptions filled. If it's a maintenance medication, the pharmacy can dispense quantities greater than prescribed. There's a couple of caveats to that. The pharmacist must use their professional judgment when they're doing that. Also, the pharmacist needs to reach out to the prescriber to make sure that if they are going to prescribe greater than the original prescription asked for, that the prescriber knows that and is okay with that. But ultimately, if the prescriber can be reached, then the pharmacist must follow the prescriber's instructions. One thing that's been affected by the COVID-19 situation is licensure. And it just happened to be that our technician licenses, the trainees, their licenses are coming up. Actually, it was in April is when they were going to be licensed. That has been extended to 6 months after the health emergency has been lifted. So not 6 months from April, but whenever the state of emergency has been lifted, the technician trainees can get your licenses 6 months after that. We hope the pharmacist licenses are not impacted by the COVID-19 because they're renewed in October. So hopefully things are a little bit more back to normal by then. But as that approaches, make sure that you are looking out at the Board of Pharmacy website. One other thing is pharmacists that can immunize, they have to have a CPR certificate. The CPR certificates are not being issued right now. So if you fall in this category and you have an expired CPR certification, you actually have to have that renewed 6 months, up to 6 months after the emergency has been lifted. So again, the board knows that this is a unique situation. We want to make sure that our patients are still being looked after. Sorry, needed a drink of water there. Okay, so let's talk now a little bit about integration. I had mentioned before that we want to improve the use of the PMP. And we've heard that there are some difficulties. We know that the medical professionals are very busy. And so we want to make it as easy as possible to give them access to the PMP. And the most important one that we've been working on the last couple of years is called integration. And really what that is you can have direct access to the PMP through your electronic health record system or your pharmacy software. you're looking at the record of the patient, and you should see a button there that says PMP. You should be able to click that button. Have a couple of check marks that you can check. Maybe you want to check other states, maybe a different spelling. You click on that, and that will give you access to the PMP instantaneously. This integration has happened quite a bit in the state. Most of the big health entities in the state have integrated, and they have liked that it's been available to them. If you are not integrated, whether in a pharmacy or in your medical office, don't worry about it. The Aware portal, which is what you're using right now, will still be available. If you are not integrated, it's a little bit of a process. We at the PMP team will help you through it. There's some forms to fill out. There's some things to sign. We have a great integration web page that we keep up to date. It gives you all the information on the process you need to do, what you need to sign, who you need to send it to. At a certain point, we hand you off to our vendor, and from there, a lot of the technical stuff happens where that connection is made with the integration itself. So again, the web page gives you a lot of good information about it. I talked about delegates when I was talking about people that have access to the PMP. By law, please keep this in mind, by law, you are not allowed to share your account with anyone else. So if you have an office manager that's pulling reports for you, he or she must have their own account. Delegates, again, are able to pull the patient utilization reports and have them ready for you as you're going throughout your day. Delegates do not have access to any of the other reports that are available, such as for prescribers, the MyRx. In order to get a delegate, the delegate would set up a delegate, the delegate would set up their account, and it's not active until they put in the information of the doctor or doctors or the pharmacist that they're going to be a delegate for. That the doctor or doctors would go in and they would affirm that this person is going to be a delegate, and then that link is made. A delegate can be a delegate for more than one doctor in a doctor's office. They just need to make sure that when they're pulling reports that they choose the correct doctor, so that doctor knows what reports were pulled for him or her. Same thing goes for the pharmacies as well. Okay, so wrapping up, again, the ultimate purpose and the reason why we have the PMP is just to give medical providers more information so they can make the best decision possible for the well-being of the patient. We know that the PMP is not the silver bullet when it comes to the opioid crisis, but it has made an impact. And every day we try to make it as easy to use as possible. We try to make it accessible as possible. And again, we are seeing this sort of wave of acceptance in the medical community that we really like, but there is more work to do. And we are trying again to get out there and sing its praises. But there are some other additional resources that are available for you. And I want to share those right now as you are. Again, this presentation is going to be provided it is being recorded, so you don't have to scribble notes and stuff like that. But the first one is the OR line, the Opioid Assistance and Referral Line. This is a part of poison control. It's housed down in Tucson. It is, these are health professionals that help other health professionals and the public with any questions regarding opioids or controlled substances. They can help you with dangerous drug combinations, MME values. Probably the most important thing that they can do to help you with if you're dealing with somebody who you feel might have a challenge with substance abuse disorder, they can give you a warm referral to a treatment center. So again, the OR line is free. Make sure that you write that number down. Look it up on the web page to get more information from it. It's an important resource to have. Again, we're dealing with somebody who might have a challenge with substance abuse. Probably most of you are aware that there is Dr. Chris from the Arizona Health Services has a standing order for naloxone, which is basically anybody in the state can go to a pharmacy and have it filled. That is the prescription. So just note that that's there as well. Something else that the ADHS has put out is the prescribing guidelines for opioids. A wonderful resource. It's free. You can go to the ADHS, the Arizona Department of Health Services website. You can download a PDF of it, or you can order hard copies for it. It just gives you information on how to prescribe for pain that might be acute. It also will give you guidelines on prescribing in chronic situations. It also has a list of suggestions that you might want to consider when you are dealing, or when you are helping a patient who's dealing with pain. Alternate medications that you might use, or instead of prescribing opioids, maybe some other form of therapy that you can help the prescriber with. And one of those recommendations is using the PMP. So I've been talking a lot. I've been talking pretty fast. Oh, 12:45, right on the dot. Just a couple things really quick. The CSP, the PMP team at the Board of Pharmacy, we have our own website. We keep it up to date. It's actually going through a big transition right now, so it's going to be even easier to use. Go there if you have any questions about PMP integration. Again, we keep it up to date as much as we can. We've also got some training material on there as well. Probably the most important thing is just the contact information. You can call us, you can email us. We work very hard to get back with folks as quickly as possible to help them with their needs. If you have any questions, I didn't really go into today about sort of the nuts and bolts of how to use the PMP. We actually have some really good training videos. They're anywhere between 4.5 minutes to 6 minutes long, but they cover registration, they cover how to request the report, patient report, how to understand it. There's also one on the MyRx if you're a prescriber and you wanted to know a little bit more about that. They're always available. So just keep that in mind if you have any questions going forward. All right, Christine, I think I'm ready for the questions.
Thank you so much for Lynn, for sharing the important information today about the state mandated PMP program. The chat box is open. I have not received any questions yet, but we'll give folks a few minutes to enter those into the chat box for Lynn so he can answer them.
Sounds good.
Awesome. While we're waiting for folks to do that, are there some common questions that you normally get from folks either directly to the Board of Pharmacy or ones that you've answered before in previous webinars?
The last probably 3 or 4 webinars that I have been involved with, and really the hot topic until the COVID-19 was the electronic prescribing of controlled substances. And there is, we have some information, and we actually have a video on YouTube on the Arizona Board of Pharmacy channel that talks about some of the exemptions to EPCS. It's actually very handy and for people to go out and listen to. So when the dust settles on this and we get back to where EPCS is required again, or if you just have some questions about EPCS, that's a good place to go. There are exemptions to any statute, and that seems to be the one that I get asked for most. I can't answer all those right now, but there is a good video out there for people to go and see.
Wonderful. For folks that are on the phone today, yes, the slide deck presentation will be sent out to all participants today. And we did receive a comment that it was very informative, Lynn, so thank you again.
Thank you.
Again, the chat box is open for questions, so please go ahead and take a few moments to ask Lynn any questions regarding today's presentation.
Either I'm a very good instructor or I can't compete with the ham sandwich. It's probably what's going on.
Well, your presentation is very informative, absolutely, and very important. Again, I'm not seeing any questions come through the chat box, but again, there are resources available through the Arizona Department of Pharmacy's website, as well as videos that can also help assist folks in answering questions and navigating this very important topic. Again, we're just not seeing anything come through. Just another reminder that today's slide deck will be sent out to everyone who has participated. Oh, we do have a question here. Do we need to run PMP on ADHD meds? So the question is, do we need to run the prescription monitoring program on ADHD meds?
If they are, I do not believe that they are, and I will tell you that I am not a pharmacist, so I'm going to give you my best guess, but I also will give you my my email address that you can send that to me. You know, it is a prescriber, and if it's a
they're in a pediatric office as well. So I don't know if that helps answer the question for folks that need ADHD medications.
If it is really the requirement is the if it's an opioid or benzodiazepine. Now, if you're in a pediatric, they probably do not have a PMP report to pull. So that might be something that you wouldn't have access to itself. What we tell people, if you have a question, in that regard, pull it. It's free. It's easy. You know, if you don't get any results back, then you don't get any results back. Does that answer the question? Somebody nodding? No.
Possibly. We'll give that person just a few more minutes to see if that helped answer their questions. We did receive another question. How important is it to update specialty on the profile for nurse practitioners and PAs?
So the specialty is in there because we provide a report to users that is sort of gives you an idea of your prescribing habits compared to those who are in your specialty. It's not a report card. It's not a judgment. It just sort of gives you an idea. If I'm in this specialty and I'm prescribing this many controlled substances, maybe I'm a little bit higher than other people in my field. It's just a way for you to sort of get a sense of maybe what's the average. That report is a little complicated, and we're trying to make it as easy as possible. But going back to your question about how important it is, for that report to be as helpful as possible, you want to make sure that your specialty is what it is when you go into set up or update your PMP account. You don't want to be a family practitioner, especially in your PMP account when maybe you might be a pain specialist in your practice, and that would put your numbers way out of whack. And again, it's not a report card, but it might be a little bit confusing to you when you're seeing that.
Okay, thank you. To circle back on the pediatric question for the PEDS office, they do get results back.
Oh, good.
They do not want it to be mandatory to run a PMP, is their concern. And then in addition to that, prior to RXing ADHD meds to patients, seems like it would be mandatory to run reports prior to dispensing.
So yes, so we talked about the requirements, and again, those are requirements by the statute. The dispensers, the pharmacists, their requirement is all Schedule II controlled substances is how they run the report.
Yeah, the person is also indicating the pharmacy has to run reports prior to dispensing. I can certainly connect, Stacy, if you like, with Lynn or directly, and if you have questions that could be answered privately or at a separate meeting. So I'm happy to connect the both of you together to talk. And she said, yes, please. So.
Sure. Yeah, and actually, one thing that I omitted from the slide deck that should be in there is my email address. It usually is. Let me give everybody my email address. You are more than welcome to send me any questions you might have. I know when we get specific, it can get a little bit confusing, and so I just want to make sure I get them all answered the way I need to answer them. My email address, my first name is Lynn, last name is Curtis. My email address is L, and then it's Curtis, C-U-R-T-I-S, at azpharmacy.gov, G-O-V is in Victor, gov. Oh, we just put it up there.
I did also put that in the chat. So
okay.
Looking at the chat feed, Lynn Curtis is there, L Curtis at azpharmacy.gov, and we'll certainly get you and Stacy connected to talk further about that.
Yes, Stacy, thank you. I want to make sure I get it answered for you, and I'm sorry I'm not able to right at the moment.
Wonderful. Thank you, Lynn. Any other final questions through the chat box before we conclude today's webinar? This has been a great discussion again, Lynn. Thank you so much for your time. We'll pause there for just another few moments, see if we have any future questions. And again, Lynn's email address is there for any direct follow-up questions with him. And he can circle back around with folks. I'm not seeing any additional questions come through, so we'll go ahead and conclude today's webinar. Just a reminder, today's webinar has been recorded and will be posted to the Health Current website in the next couple of days. Thank you to Access, ADHS, and the Arizona Board of Pharmacy for joining us and joining Health Current today and supporting this webinar. And thank you for your participation. Stay safe out there and have a wonderful rest of your day. Take care.
Thank you, everybody.